So for the 5 factors of the IVF, I'm going to be testing nerve. I'm going to start by doing a muscle test for the iliacus. So I'm going to have the patient bring the leg up, externally rotate, resist. We have a weak muscle, so I'm now going to have them therapy localize at the upper lower back L1, 2, 3 region. Then therapy localize there as best you can. Retest the muscle. Externally rotate. Now we have a strong muscle. So now I'm going to identify the segment. So I'll have them therapy localize at L1. We'll retest. And we have a weak muscle, so now I have them therapy localized at L2. Retest, hold it up. And the weak muscle there. So now we'll do at L3, go ahead and therapy localize L3, hold it up, resist. Now we have a strong muscle. Now I'm going to identify the side of the segment where the issue is. So I'll have the patient flip over. I would identify a good indicator muscle via autogenic inhibition. And in this case, since he is prone, I'm going to use the glute max. So I'm going to start, I'll do a muscle test. Upper glute max. Hold that there for a second. Good. Right, I'm now going to perform a rebound test. So I'll go in at L3 on the right side. Retest glute max. Hold up and resist. That makes it go weak. So now we'll do it on the left. Resist. Bring it up. And resist. That made it go strong. Since it made it go weak on the right side, that would indicate that I have an issue at the right side on L3. Right. I'm now going to fix my lumbar issue that I identified on the right side. So I have my patient lie in left side posture. Up, and then I'll perform the adjustment on the lumbars. And now I would retest the iliacus. And now we have a strong muscle. I'll have them therapy localized. And we have a strong muscle there. Right, I'm now going to be checking the 5 factors of the IVF on the iliacus. I'm going to start with nerve, so I'll just have him place a broad hand contact on his upper to lower back. Well, first I'll perform a muscle test to make sure that the muscle is strong. So come up, externally rotate, resist. Good, we have a strong muscle. Now I'll have therapy localize the upper lower back. Up, externally rotate. Now we have a weak muscle. Now I'm going to do neurovascular, so I'll have him therapy localize the base of his occiput with his right hand. Up, out, test. We have a weak muscle. Now we're going to do neurolymphatic. So I'm going to have him therapy localize 1 inch above the umbilicus and 1 inch laterally. Test. And we have a weak muscle. Now going to do AMC, so I'll have him therapy localize at the posterior aspect of the 12th rib. Right here. And resist. We have a weak muscle there. Now we'll do CSF, so I'll have him take a deep breath in. We have a weak. Good, breathe out. And hold. And we would weak muscle there as well. We're going to be performing the muscle test for the low back scan. I'm going to start with the abdominals. Have the patient sit at the end of the table, cross the arms in front without touching his chest, lean back about 20 degrees, stabilize the legs and push. Next I'm going to do external and internal obliques and have the patient turn. I'm going to be testing the left external and right internals on this side. We'll push. Good, strong. Go ahead and turn now. And this time we're testing right externals, left internal. Good, resist. Good. Next we're going to be doing the QL, so I'll have the patient lie supine. I'm going to bring the legs over to the opposite side of the table. In this instance, we would be testing this QL. Underneath, I'm going to pull and have them resist. Good. Next, we're going to do rectus femoris. I'm going to bring the leg up, have them hold there. I'm going to push. Good. Relax. And next, iliacus, turn the leg out. Push, resist. Good. The psoas muscle test. Up 45, up 45. Extend right there. Go ahead and hold there for me. Resist. Good. Sartorius. I want you to pull your heel to your back pocket. And resist. Pull towards your pocket. Yeah, there you go. Good. Sartorius. Gracilis, internally rotate. And hold. Good. Adductors, foot straight up. Hold. Good. Glute med. Go ahead and hold. Good. And TFL. Go ahead and hold it out there. I'm going to try to pull in. Good. String muscle test. I'm going to bring the leg up into about 30 degrees of flexion. Have the patient hold there. Going to get onto the muscle, belly of the muscle, and push, resist. Good. To bias the medial, I'm going to pull the leg towards me. Have them hold there. Get on the belly of the muscle and push, resist. Good. Lateral towards him. Hold, resist. Good. Piriformis, I'm going to bring the leg over. Have him hold there, and I'll pull back towards me, resist. Good. Now I'm going to do glute max. I'm going to lift the leg up off the table, have the patient hold it, stabilize the low back, push, resist, good, relax. And finally, sacrospinalis. I'm going to have the patient lift the right shoulder up off the table, stabilize, then I'm going to press, good, have them lower half an inch, push, half an inch, push, and then I'm going to do that 2 more times. We're going to start with the tibialis anterior muscle test. Up in the dorsiflexion, in, pushing diagonally this way, resist. Good. Tibialis posterior, plantar flex, in, pushing across, resist. Good. Peroneus longus brevis, plantar flex, push out, resist. Good. And then peroneus tertius, dorsiflex, push out, and resist. Good. Gastroc muscle test. I'm going to place my hand on the lateral aspect of his leg, have him pick his leg slightly up on the table. Plantar flex, I'm going to try to pull him out. Plantar flexion. I'm going to have him flip over now. I'm going to do the soleus. Bring the leg up. Put it into plantar flexion. I'm going to try to pull up to the heel and push down on the toes while you resist. Try to take him into dorsiflexion. We're going to be doing the fixation scan now. I'm going to start with lumbar, so I'm going to have the patient lift his arms up off of the table, straight out in front of him, lift his head up, and underneath, and I'll have him resist. Good, that's testing for lumbar fixation. I'll rotate to the right now, and resist. Good, this is right SI, rotate to the left. Resist, good, that's left SI. And relax now. If we were to have weakness both ways, that would be indicative of an issue with the sacrum. I'm now going to test the lower trap, so I'll have the patient go arm out in front, stabilize, resist, good. Lower trap, and I'll be looking for issues in the TL junction, middle delt, and cervicothoracic here. Teres major, so arms on the low back. We'll be testing this bilaterally. And for the last 2, I would have needed bilateral weakness in order for it to be a fixation. This is going to be teres major now. I'm going to press down, go ahead and resist. Good. Glute max. Go ahead and place your arms back by your side. And lift the leg up. Go ahead and hold that there for me. Going to push, to resist. Good. Popliteus. Rotate the foot inwards. Go ahead and resist. Good, and that's going to indicate problems at the lower cervical. Go ahead and flip over for me now. Yeah, test the psoas. Up 45, out 45, externally rotate. Go ahead and hold there. Resist. Good, and bilateral weakness here would indicate an issue with the occiput. Okay, we're going to be fixing a fixation in the cervicothoracic region. In order to test for this, I'm going to do a middle delt test. So I'll have the patient put his arm out to the side. I'm going to pull back. He's going to resist. We have weakness here. And in order for there to be a fixation, we would have to have bilateral weakness, which I have found. So now we're going to begin our palpation in the cervicothoracic region. We're going to start at C6 and C7 on the TVPs. Right TVP of C6, left TVP of C7. And we have resistance at C7, no resistance at C6. And now I'm going to switch TVPs on the segments. And resistance at C7, no resistance at C6. So now I'll go to C7, T1, right TVP of C7, left TVP of T1. And we have resistance at both. Now switch TVPs. Resistance at C7 and T1. So now I'll go to T1, T2, right TVP of T1, left TVP of T2. Press through. We have resistance at both. Switch TVPs. And we still have some fixation going on there. So now we'll go to T2, T3, right TVP of T2, left TVP of T3. Press through. We have no movement at T2, movement at T3. Switch TVPs. No movement at T2, movement at T3. So now we'll check T3, T4. Right TVP of T3, left TVP of T4. Got movement at both. Switch TVPs. Movement at both. Okay, so I've identified my stack as being C7, T1, and T2. We're now going to identify where we need to adjust in the stack. So we'll start at the top of the stack, and we're just going to press P to A on the TVPs, seeing which side offers most resistance. I have more resistance on the right side. So now I'm going to come to the center, press S to I, and we have more resistance on the right side. So this would indicate that I need to adjust at the top of the stack. I'm going to do a syncopated adjustment at the top of the stack. Excuse me, I need to begin my adjustment at the top of the stack, and then we'll finish at the lower part of the stack. So I'll start on the top right part, lower left part of the stack. Once again, syncopated. Boom, boom. Right. Now we'll retest. Arm out to the side, middle delt. Resist. We have a strong muscle. Retest the other side, and that would also be